Minister, we've obviously discussed, it's quite demoralising actually many times, the critical and dysfunctional nature of the HSE in terms of its impact on citizens from really before the cradle to the grave, starting with the crisis in maternity services and how much more costly and better it would be for everybody if we based ourselves more on community midwifery services. But I just want to highlight very briefly what has been described as really a Mad Hatter situation, where we have a very small charity propping up the HSE with regard to the care of very vulnerable children with severe disabilities. And I am of course talking about the Jack and Jill Foundation, who do incredibly good work, who operate on the basis of an excellent service with a 17-year track record, no waiting lists, dealing with kids every day of the year, 24/7, and who are not able to take on children up to the age of 6, which would put us in line with Ireland's early years strategy, because they don't get sufficient funding. And there's an actual crisis at the moment in the North Dublin area, where a number of children, 3 at the moment, with severe disabilities, who are waiting to transition into the HSE, and despite ample warning being given by the Jack and Jill Foundation that this scenario was coming, those 3 children have been left in limbo. They've been left, if you like, at the mercy and the kindness of the Jack and Jill Foundation, who can't sustain the extra funding needed into the new year. And this is just one example of the dysfunctional nature of our health service, about the lack of joined-up thinking, because we often talk about this organisation, for example, getting 630,000 annual funding. That's not actually true. They don't get that. They get just over 500,000, but some of the monies that are supposedly given to them are HSE hours that are filtered through them. And if we really want to improve our health service, then we need to base ourselves on community provision, palliative care, and a much more greater emphasis on those areas.